Good afternoon, everyone. You are very welcome to the Healthy Eating at Work webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. We would be delighted if you could tweet about today's webinar using the hashtag #HealthyEatingAtWork. Without further ado, I will now hand you over to Sarah O'Brien, National Lead Healthy Eating and Active Living Programme in Health and Wellbeing. Thank you.
Thank you, Helena, and good afternoon and welcome everyone to our webinar on healthy eating at work, from standards to practice. I'm delighted to welcome you all here at last. The original date for this webinar fell victim to the cyber attack earlier in May. So it's fantastic to be here. We have a very interesting agenda lined up for you this afternoon that will kick off with an address from Minister Frank Fionn to officially launch the nutrition standards for the provision of food and beverages for staff and visitors in health settings. The rest of our time this afternoon will focus very much on the tools available to support the implementation of these standards across our services, including training and the Healthy Eating at Work Awards scheme. And we'll also hear the results, just published results of a research study on calorie posting implementation across HSE hospitals. And as always, have plenty of time for discussion and Q&A with our panelists at the end. And as Helena mentioned, do use the Q&A section there at the end of your screens to let us know what your questions or your comments are. Before I go any further, can I bring your attention to a poll we're running during the session today? It'll pop up on your screens. It would be great if you could fill it in, and we'll bring the results to you later on. So Helena, if you don't mind, maybe just popping up the slide for me, please.
Just one moment, please, Sarah.
Thanks. So you see just the questions in terms of our poll. Just were you aware of the nutrition standards before today? And also just would like to hear from people on whether you've completed any of the nutrition modules on HSE land, and you'll hear more about both of those as we go through today. That's great, Helena. Thank you. Apologies. Okay, if you can move on to the next. Great. So I suppose just as we start the webinar today, I suppose just to set our work in its context, both at a national policy level within the HSE and also wider. The Department of Health, under the Healthy Ireland framework, would have published the Healthy Weight for Ireland Obesity Policy and Action Plan back in 2025. Or 2021. It's a 10-year plan that runs to 2025, and it very much provides an overarching evidence-based approach to addressing the challenge of overweight and obesity within Ireland. A subsection of that plan is the implementation of the Get Ireland Active National Physical Activity Plan. In terms of the Healthy Weight for Ireland Action Plan, the policy is cross-sectoral, and it has a particular suite of actions that are for health services, and one of those in particular relates to creating healthier food environments in the health services, and that's very much what we'll be talking about today. The Sláintecare Healthy Ireland Strategic Action Plan, which was launched earlier in the summer by the Department of Health, puts a renewed focus now on driving forward the many cross-sectoral actions within the Healthy Ireland framework and the Healthy Weight for Ireland Action Plan, with a focus on building on the successes over the last 7 years. Minister Fionn, when he's speaking with us later on, will touch on a lot of that for us. The Healthy Ireland Framework, published in 2015, mandated the establishment of a number of policy priority programmes within the HSE, to provide leadership and coordination for the implementation of key national policies like these across the health services. So the next slide, please. So out of that, the HSE Healthy Eating Active Living Policy Priority Programme was established in late 2016, and our remit is very much to mobilise the health services to improve health and well-being by increasing the levels of physical activity, healthy eating and healthier weight across service users, staff and the population as a whole, with a focus on children and families. We do this by focusing on 5 key areas of action. These are set out in detail in our national implementation plan. But the overall objective of our work in these 5 areas is to contribute to the reduction in rates of chronic disease, such as heart disease, diabetes, cancer, and obesity, as well as improving the quality of life for those currently living with chronic disease. So today we're focusing very much on our work to promote healthy eating in the health services under Theme 3. So you can move on, please, Helena. Okay. So before I go on to talk about our work under Theme 3, just maybe to bring your attention to the Healthy Food for Life guidelines that were developed by the Department of Health, HSE, and a number of other key stakeholders, including Safe Food and the Food Safety Authority, and published in 2017. These guidelines are evidence-based, and they provide clear guidance for a healthy diet for adults, teenagers, young people, and children over the age of 5. There's a similar set of guidance for children aged 1 to 4 as well, just slightly different because of their age and stage in life. And so the big focus of our work is very much around promoting these guidelines and providing tools and resources to support people translating them into practice. Multiple national surveys, whether those are diet and nutrition surveys by universities across Ireland, or the Healthy Ireland survey, which is run on an annual basis, tell us that as a nation we're not consuming a healthy diet overall. Most of us eat too little vegetables, fruit and salad on a daily basis, and are consuming too many foods high in fat, salt and sugar for our well-being overall. All of us will know that our diet impacts very much how we feel, how we look, how we perform every day, and over time a poor diet, the cumulative impact of a poor diet, can increase our risk of developing chronic diseases such as I was saying earlier, heart disease, diabetes, some cancers and obesity. And I'm not going to kill you with figures and percentages, but chronic diseases like these are contribute to most of the inpatient stays in our hospitals. If you can move on to the next slide, please. Great. So in terms of mobilising the health service to promote healthy eating and active living, in our implementation plan, we have kind of 2 key areas for focus. One is in relation to patients and service users. When people are in our care, whether that's a short hospital stay or a longer stay in some of our services, they very often will have little control over what they eat and when they eat. And for some people, particularly those with acute illness, they may require a diet that is somewhat different to the usual healthy eating diet to help with their healing and recovery. So we would have highlighted this in terms of action 11 in our implementation plan, and a lot of work has happened in the last number of years, led by Margaret O'Neill, the former National Dietetic Lead in Health and Wellbeing, to develop a number of policies, supporting toolkits, training and clinical guidelines to assist staff in our healthcare settings, whether that's on the catering side and the dietetic side, on the nursing side, care side, to improve the food, nutrition and hydration care. And all of this work and these policies also support and enable our sites to meet their obligations under the HICWA quality standards as well in terms of patient care. And some of the elements that you'll hear about later today, particularly the training that Geraldine will speak about, will support you and will be useful for you in putting these into practice. Do you want to move on, Helena? Great. Okay, so then the second area of focus for us was very much on our staff. We are the largest public sector employer in the state with over 110,000 staff in 2,500 locations. A third of our time in general is spent in the workplace. And for staff who work on shifts or work in hospital or care settings, food provision, whether it's in canteens or in the workplace, is an important part of their daily diet. As the largest employer in the public sector, we have a responsibility to actively support our staff to the health and well-being of our staff when in the workplace. And the forthcoming workplace wellbeing framework from the government will only place a greater emphasis on that. So today, with the launch of the nutrition standards for the provision for food and beverage provision for staff and visitors, we are building on a body of work that has been ongoing across our services for the last number of years, whether that is in relation to the implementation of the calorie posting policy, the vending policy, or what were the Happy Hearted Work Awards and now the Healthy Eating at Work Awards. So the speakers across the rest of the webinar and the panel discussion will be showcasing a lot of practical tools and resources that will help with the implementation of these policies and strategies to improve the food environment across the services. And we'll also hear of some excellent examples of good practice. But first, I suppose before we hear from on that great work, I'd like to welcome and invite Minister Fian, Minister of State for Public Health and Wellbeing and the National Drug Strategy, to formally launch the HSE nutrition standards for food beverage provision for staff and visitors in the healthcare setting.
Good afternoon, everyone, and as Minister for Public Health, Wellbeing and the National Drug Strategy, I am delighted to be here today to address you at your Healthy Eating at Work webinar and to formally launch the HSE nutrition standards for food and beverage provision for staff and visitors in healthcare settings. My department will be launching the National Healthy Workplace Framework later this year to support health and well-being in the workplace, and the implementation of these standards will support the broader agenda. The Healthy Ireland Strategy and the recently published Healthy Ireland Strategic Action Plan 2021 to 2023 put a strong focus on improving health and well-being by supporting people to make healthy food choices. Current research provides a strong evidence base for healthy dietary patterns of lower fat, saturated fat, and salt and sugar intakes, together with a higher vegetable, fruit, and fibre intake to lower the risk of overweight, obesity, and chronic disease. The Healthy Food for Life, Healthy Eating Guidelines and Food Pyramid for Adults, Teenagers and Children over 5, developed by the Department of Health and the HSE and key stakeholders, provide clear guidance on what constitutes a healthy diet and how to make healthy food choices. The HSE nutrition standards for food and beverage provision for staff and visitors in healthcare settings, which I'm happy to launch today, helps translate the Healthy Food for Life guidelines into clear steps that catering services can take to help those who purchase and consume foods from their services to maintain a healthy eating pattern. This work to improve the food environment and health services builds on work led by the Department of Health in other sectors, including the development of the nutrition standards for school meals and the nutrition standards for early learning and care services currently being finalised. Halting and reversing overweight and obesity levels is a priority for my department, and we all know the figures. 6 out of 10 adults in Ireland are living with overweight and obesity. At a society level, we are all living in an environment that is increasingly obesogenic, where access to calorie-dense, nutrient-poor foods are readily available and in many cases easier to access than healthier foods and drinks. The Department of Health, through the implementation of the Healthy Ireland Strategic Action Plan 2021-2023, is putting a greater focus on policy initiatives to create more supportive environments for health and well-being, and these initiatives include working with government to support planning restrictions on outlets selling high-calorie junk foods and beverage adjacent to schools, finalising a reformulation roadmap and action plan to reduce the amount of fat, saturated fat, sugar and salt in foods commonly consumed in the Irish diet, developing guidance to restrict the marketing of unhealthy foods to children and adolescents, and developing a Healthy Communities programme to address a comprehensive range of issues, including barriers to healthy eating in the most disadvantaged areas. These HSE nutrition standards are an example of how an organisation and workplace can take practical steps to tackle the obesogenic environment by ensuring that healthier food and drink options are readily available and actively promoted. I look forward to the next stage of the implementation of the standards across the health services and seeing the work with hospital groups and community healthcare organisations throughout the country to achieve these standards. As the largest employer public body in the state, it is important that the HSE provides leadership in this area, and I congratulate all those involved in developing these nutrition standards and all of you for implementing them. Thank you.
Thank you very much, Minister Fian, for those very kind words. Just to say, it's really positive to hear about the renewed focus at government level in addressing some of the many aspects that contribute to the obesogenic environment we live in. So we're really looking forward to seeing that work progress over the next number of years. Just to say, I suppose maybe some people in our audience may not be familiar with the term obesogenic environment. A colleague in communications always told me never to use a word that you can't explain in a sentence. But basically, I suppose it means how aspects of our environment that we don't have direct control over influence our body weight. For example, the food available to us, the levels of physical activity in our daily life, and the examples there that Minister Fian gave in terms of work that's going to be ongoing will give a sense of the breadth of things that can affect and influence our body weight. So I'm really pleased now to invite and welcome Geraldine Sexton, registered dietitian with Health and Wellbeing, to speak about the nutrition standards and the training to support them that is available on HSE land.
Good afternoon, everybody. You are very welcome to today's webinar. My name is Geraldine Sexton, and I'm one of the registered dietitians working with the Healthy Eating Active Living programme of the HSE. So today I'm going to talk a little bit about the standards themselves and also some of the e-learning modules that are available on HSE land that will support you in implementing these standards. So as we've all heard, the HSE is committed to maintaining and promoting the health of the whole population as part of its implementation of Healthy Ireland, a framework for improved health and wellbeing 2013 to 2025. And creating supportive environments for staff and visitors to make healthier choices is a strategic priority, and that is where this initiative came from. Now, just to mention, these standards were developed in collaboration between the Healthy Eating Active Living programme of the HSE and Safe Food, and they have been adapted from the minimum nutrition standards for catering in health and social care in Northern Ireland. So it's extremely important that we do acknowledge this and that we acknowledge it with thanks. So as I mentioned, the purpose of these standards is to promote awareness of healthy eating and to increase the consumption of healthier food and drink choices amongst HSE staff and the public who are using and visiting HSE healthcare facilities. So you may ask the question, why is this actually a priority? Why is this important at all? Well, we all know that diet has a critical role to play in the prevention of obesity and chronic diseases, including heart disease, diabetes, and certain cancers. And in 2015, the WHO projected that Ireland is on the course to be the most obese country in Europe by 2030. So what they're predicting is that 89% of Irish males and 85% of Irish females will be overweight, and 48% of Irish males and 57% of Irish females will be obese by 2030. Now, the evidence shows that one of the key contributors to these adverse trends is the obesogenic environment that we are all living in. And it's this environment that really does make the unhealthy option, so those foods that are high in fat, high in salt, high in sugar, the easier option for many of us. The evidence also shows that the environment and culture within which we work and deliver our services also has a major influence on the health and well-being of both staff and service users. And as the HSE is one of the largest employers in the country, they have a fantastic opportunity to make a real difference. Now, I do need to acknowledge that many HSE facilities have been working for several years to provide good quality, healthy food for staff and visitors, and many have received the Happy Heart Health Eating Award from the Irish Heart Foundation in the past. So these standards will really just strengthen their work, as well as supporting other facilities to improve their choices for staff and visitors as well. So let's have a quick look at the standards. And what I'm going to do is I'm just going to share my screen. So if you bear with me for 1 minute, and let's hope this works. First time, excellent. Okay. So the nutrition standards for food and beverage provision for staff and visitors in healthcare settings are basically a combination of nutrient and food-based standards that have been developed around the Irish Healthy Food for Life Health Eating Guidelines and the Food Pyramid, which was published in 2016. And that document was developed to help people design their plates in an extremely flexible way so that they can follow a varied, healthy, balanced diet. So very briefly, oh, no, that's not working for me. Very briefly, let's have a look at the food pyramid. Now, I'm sure that you've seen this many, many times before. It's the pictorial guide that goes with the guidance document, and it's probably what the public would see more often. So as you can see, the food pyramid is made up of many different shelves, and at the bottom we have the fruits and vegetables section. Now, having these foods at the bottom is really emphasising that fruits and vegetables should make up the majority of the food in our plate. And if you look at the standards, or when you get a chance to look at them, you will see that the very first standard, the very first one, is that we should have at least 5 different types of fruit and vegetables available for the consumer every day. And the reason for this is that different fruits and vegetables contain a wide variety of different vitamins, different minerals and phytonutrients, and that they all benefit our overall health and protect us from chronic disease. Different fruits and vegetables also contain different types of fibre or prebiotics that benefit our gut health too. And this is the reason why you're often hearing the recommendation that we should have a rainbow of colourful fruits and vegetables on our plate. Now, serving size is also mentioned. So the standards do highlight that a portion of fruit and vegetable is roughly 80 grams. Now, in the kitchen, you'll probably have a serving spoon that will deliver that amount. But just to give you a visual, that 80 grams is roughly the size of your fist or a tennis ball or a slitter, whichever one you're used to looking at the most. Now, on the next shelf, we talk about the whole grains, and we are encouraging catering departments to ensure that higher fibre starchy options are available at all meal times. So that's things like your brown rice, your wholemeal pasta, and your potatoes with the skins on them. The guidelines are also asking that 50% of breakfast cereals and 50% of breads are high in fibre. And the reason for this is that the evidence in the literature is extremely strong in relation to the health benefits of minimally processed and whole grain foods. Again, think of things like supporting your gut health, cancer prevention, especially colorectal cancer, prevention of cardiovascular disease, type 2 diabetes, and obesity. Next shelf, we have the dairy shelf, and we are currently asking that milk and dairy foods are made available at each sitting, and that they are reduced fat varieties. Now, a lot of people are moving away from taking dairy for their own personal reasons. So if and when plant-based alternatives are offered, they really do need to be fortified and they need to be unsweetened. The next shelf, this is probably one of my favourite shelves, as it's packed full of different protein sources from both animals and plants. So on this shelf, you have things like your meat, your poultry, your fish, you've got your eggs, your nuts, your seeds, tofu, and your legumes, which are your beans, peas, and lentils. Now, most people only think of animal sources when they hear the term protein, so it's fantastic that there's a greater push on the plant sources too, especially when we think about protein as a package, meaning that when we eat foods with protein, we are also eating everything that comes alongside it, the different fats, the different fibres, sodium, etc. And it's this protein package that's likely to make a difference for health, so offering a wide variety of protein sources will ultimately improve the consumer's overall health. Now, I'm not going to go through each of the different standards for this shelf, but just to mention a couple. So more often than not, the vegetarian option is a cheese-based option. So we are asking that you limit your cheese-based vegetarian options to twice weekly. We are also asking that there are at least 2 days each week when you do not offer any processed meat, processed poultry, or battered fish. And this applies to your breakfast options, your lunch options, and your evening meal options too. And it also applies to salads and sandwich counters. Now, I think you'll agree that the wide variety of protein sources that are available can make both of these standards very easy to implement, which is absolutely fantastic for all involved. Next shelf then, we have the fats, the oils, and the spreads. So here we're encouraging less saturated fat and more unsaturated fat or plant fats in line with the Mediterranean dietary guidelines. And then just floating above the top of the pyramid, we have the foods that are high in added sugar, added fat, and added salt. And these are the foods that really need to be conscious about eating. So we don't want to overindulge in these foods. So we want to support the consumers. And how we're doing that is by asking that there must be at least 3 out of 5 or 4 out of 7 days each week when high fat, starchy foods such as your chips, your potato wedges, sausage rolls, garlic breads, or roast potatoes are not served. So when we have a look at the standards, and if you have a copy of them, you will see on page 16 through to 21 that each of the standards are set out in a similar manner to the food pyramid, and that you are provided with the standards, the types of foods that are included, and the recommended portion sizes. This is then followed by a section for caterers to guide them to improve the nutrition quality of food provided. So recommendations on purchasing, preparing, and cooking, as well as displaying and serving to the consumer. We then have a short reference to the HSE calorie posting policy and the HSE bending policy, which due to time constraints, I won't go into today, but you can find both policy on the HSE website. Finally, I just want to show you some of the nutrition modules. So just bear with me another second when I pull them up. So the different nutrition modules are available there on HSE Land. So when you put in hseland.ie, you'll get an option to put in your login details. When you log in, then you are going to come to the homepage, which looks like this. Okay, and if you just scroll down and look for hubs, this is what you're looking for. Okay, so it's purple. When you double click on the hubs, then you are going to come to this section and you are looking for the discovery zone. Okay, so again, double click on the discovery zone. When you come to the discovery zone, you have 2 options. You can search for what you're looking for or select a topic. So I'm just going to type in nutrition, and straight away we get the HSE nutrition training modules. So if we just double click on that, you can see that at first here we have the different policies. So we have the food, nutrition and hydration policy for adult patients in acute hospitals, and the implementation toolkit for food, nutrition and hydration policy for adult patients in acute hospitals. And then we also have the nutrition standards for food and beverage provision for staff and visitors in the healthcare settings. So if you're looking for either of those policies, that's where you'll find them. If you scroll down, then you are going to see different sections. And here in section 2, you can see that there's the different modules to support you in supplying food in acute care setting. So in it, we have lots of different modules. We have got the regular hospital diet for inpatients. So you can see there's a webinar on introduction, on menu planning and practical workshops. We've got energy dense diets for inpatients. We've got healthy eating diets for inpatients. And just to say as well, the healthy eating diet for inpatients is quite similar to the standards that we're launching today. There's also training modules on how to provide gluten-free food for any inpatients that might be in your hospital setting. And then in section 3, we have a module on the nutrition standards for staff and visitors. So that's everything. Thank you very much for listening today. If you have any questions, do feel free to pop them in the chat box. There is a Q&A section at the very end. So we will answer your questions at the end, and I will pass you back to Sarah. So thank you very much again for listening. Take care.
Thank you, Geraldine, and thanks for that very thorough walk through the guidelines and also how to navigate HSE Land to get to the training modules. They're an excellent resource, but it's just sometimes finding where they are can be difficult. So before we move on to our next speaker, just to remind people there, do use the Q&A function if you've any questions as we're going through, and we will pick up if either answer them live or pick up on them when we come to the panel. So next up is Orna O'Brien. Orna works at the Irish Heart Foundation and is leading out their work to support the health service sites participate in the Healthy Eating at Work Awards scheme. So welcome, Orna.
Thank you very much, and it's a real pleasure to be here. My name is Orna and I'm the dietitian with the Irish Heart Foundation. So I'm really delighted today to speak to you about the Happy Heart Healthy Eating Award, and it actually follows on very nicely from what Sarah and Geraldine were exploring earlier, because the Healthy Eating Award is a very practical example of how we can help implement the HSE nutrition standards. So I'm going to briefly describe what's involved in the Healthy Eating Award and how we have changed our focus in 2021, the rationale behind it, and of course the impact of it. So the Healthy Eating Award is a very unique health promotion programme. It was created by the Irish Heart Foundation 25 plus years ago now, so from the mid-90s onwards. And our goal was to facilitate heart healthy choices in staff restaurants so that they were available to staff, and as well as that, to encourage staff themselves to make healthy choices. So it's a two-pronged approach. And this is very much a partnership approach. It's supported by the HSE, and over the past 25 years or so. And this year we've partnered even more closely with the Healthy Eating and Active Living team in the HSE. And I'm sure it's a similar case for most people listening on this webinar, but 2020 and 2021 have been dramatic years for us, and it changed very much how we work in the Irish Heart Foundation. So in 2020, we reviewed our current activities and we decided to discontinue offering the Healthy Eating Award to corporate sites, because as part of our new strategy, we want to increasingly focus on tackling health inequalities. So we've decided to dedicate our resources into those areas where it's needed most. And as healthcare workers really promote health to their patients, it's so essential that it's only right really that we support healthcare workers to lead a healthy lifestyle themselves. So this year we've updated and tailored the award process just to healthcare facilities going forward. And as well as that, it ties in nicely with the supporting healthcare facilities to implement the new HSE nutrition standards. So there are 3 different levels of award: bronze, silver, and gold. And the most new sites who are taking part in the award usually start with the bronze award, and each award is valid for a 2-year period. So we then, for the 2-year period, after the 2-year period, we encourage them to go to a higher level of award, so aiming for silver perhaps. And the idea is that we're implementing slow, sustainable, gradual, positive change, and that by the time the site is able to achieve the gold award, they have then fully implemented the HSE nutrition standards. So the rationale, I won't spend too much time on this because I know Sarah covered this earlier, but one statistic that really stands out to me is that we eat a quarter of the food that we eat is prepared and cooked outside of the home. And staff are relying on their workplaces for 1, if not 2 meals every day. So it's no wonder that, as Sarah said, the WHO has identified workplace health promotion initiatives as a best buy option for controlling and preventing chronic diseases. And we know they work as well. There's lots of evidence behind workplace-based health promotion programs like the Healthy Eating Award. So what does the process actually look like? So the very first step is to get in touch. And currently the process is that the HSE Healthy Eating Active Living team will contact eligible healthcare facilities to invite them to certify or to recertify. If you haven't been contacted and you're interested in taking part in the awards, the email address to contact is on screen at the moment. And you'll be asked to fill out a short survey, making sure that you're eligible to take part in the award. And eligibility just means that you're in your facility, you prepare on-site hot, fresh food. So once we receive the completed survey, we then go about into the kind of second step of the process, which is getting a group together. And this is such an important stage, because this is really the preparation phase. So it's really to set yourself up for success. You need to be able to have a coordinator on site who's going to drive this, the Healthy Eating Award forward. You need to have a Healthy Eating Award group or a committee, maybe a catering committee, nutrition steering committee that might already be in place. And that means that the award process is going to be a lot more sustainable. There's going to be a lot more staff engagement with it and ownership of the process. And it's really key at this stage that you have management involved so that you have the buy-in and the support you need to drive it forward. During this stage, the Irish Heart Foundation will support you and guide you with lots of different resources that we have available. So for example, we will send out our Happy Heart Healthy Eating Award guide. We also have a very handy checklist to help sites identify exactly what criteria they need to meet for the different award levels, bronze, silver, or gold. So once they have all these supports, they can have a look through it in their committee and decide what level of awards they think they're ready to go for. We also can provide lots of different posters and resources to support making those changes. So those changes really need to be implemented before the next step, which is to get a visit. And this step is where an Irish Heart Foundation contractor, a dietitian, comes on site at an agreed date and time to audit the current provision of the catering site. So the dietitian will look at lots of different things. For example, the menu cycle, the looking at the till area, stores area, and the provision of food, specifically looking at trying to minimize the fat, sugar, and salt content and increase the fruit, vegetable, and fiber content. And she'll also get some informal feedback from other staff who are attending at their lunchtime, and will verbally go through what changes may need to be made in order to achieve the award. So after that visit, there will be another monitoring visit, maybe 6 or 8 weeks later, and at an agreed time. And during this, this is usually the stage where the site gets certified with their bronze, silver, or gold award. And following really the point of this visit is to make sure that all the changes that were recommended have been implemented. And then following a successful monitoring visit, the award is achieved and the site gets a full report of the audit. And they're also posted a framed certificate and invited to share and celebrate their achievement at our National Healthy Eating Award ceremony, which takes place annually. So there's so many benefits of the program for both the health service employers, for the catering staff, and for hospital staff themselves or healthcare staff themselves. So for the employer, you're creating a much healthier work environment, you're increasing the productivity of the staff, reducing costs through absenteeism. There's great PR opportunities in the award as well, and it very much improves staff morale. For the caterer, you're seeing more satisfied customers. Caterers also get a chance to be a leader for other catering departments who want the award, so they get to blaze the trail. There's a really enhanced profile throughout the hospital, and also a great opportunity for innovation and really pushing the boundaries in terms of what we can achieve and develop. And for staff, then they have a much wider choice of healthy and tasty options. There's improved morale because the hospital is investing in the staff's health and well-being. And also we know that healthy lifestyle changes are responsible for 80% of cardiovascular disease prevention. and 30% of cancer prevention. So really, really important element. So much better physical and mental health well-being. And in terms of the value, so our current numbers are down obviously for the last 2 years because of the pandemic, but we do have over 99 sites with a current healthy eating certificate, and that equates to approximately 90,000 employees. So you can see that this really works on a very large scale, and it's slow, small steps that are sustainable and make a real difference over time. It's an outside organization, so you're getting an independent assessment. And these changes are more likely to be sustained over time because all the catering committee or the groups are in place. You have management buy-in. It's kept alive. It's not just a once-off information campaign. It's seen as the gold standard by many caterers and healthcare facilities, and you get ongoing support and information from the HSE and from the Irish Heart Foundation. It's very high quality, integrated service. So we come to the site itself. The advice is tailored based on each particular organization. So it is very integrated. And then lastly, I'd just like to share with you some feedback from one of our awardees, Ian O'Gorman, who's the catering manager in Tallaght University Hospital. So he said that the Healthy Eating Award had been on our horizon for several years, and we wanted to achieve external accreditation based on very specific criteria that included complete food and beverage calorie posting, completion of the HSE healthy vending policy, and very structured and healthy menu options. And this has led to greater customer satisfaction and confidence in our meal offerings. And this has been very rewarding for us. So he very much sees taking part in the Healthy Eating Award as playing a leading role in the hospital staff health and well-being, and a real sense of pride as well. So just to be at such a high standard, providing customers with the tools to make informed, healthy meal choices. And I think that's what it is all about. It's about empowerment. So I'll just leave you with my contact details. If you have any questions or something you'd like to follow up with me offline, my email address is on the screen, oobrien@irishheart.ie. And also again, that email address for the Healthy Eating Awards as well is there below as well.
Thank you very much, Orna. That was very interesting and very, very comprehensive, and it's amazing to see the level of engagement across our services already with the Healthy Eating Awards and with work to improve the food environment for our staff, visitors and patients. So now we have a short video presentation from colleagues in Cork University Hospital sharing their experience of the Healthy Eating Awards.
Welcome to Cork University Hospital canteen facilities. We started the process of going for the Happy Heart in 2019. The Irish Heart Foundation sent us this pack here, which we found very valuable because it breaks it down in easy steps to complete the award scheme. We also, in conjunction with our quality department, completed a staff survey to see what they wanted, and the majority of people came back saying they were looking for more healthy options on the menu.
Here at Cork University Hospital, we're really fortunate to have a part-time food services dietitian. This has enabled us to build a good working rapport with the catering department and a good relationship. This allowed the catering department to come to us for support and advice when they were applying for the Happy Heart Healthy Eating Award. We know that the catering department also found the HSE land resources and the nutrition standards a very useful resource.
When we implemented the Happy Heart Healthy Eating, the biggest issues that we actually encountered were with regards to our chip offering, our pastries and our portion control. With the chip offering, we changed it from 5 days a week to 2 days a week, and at first the staff were very unhappy with this because they were used to chips 5 days a week. So we now offer a half portion or a full portion. Many staff now opt for the half portion because it's the cheaper and healthier alternative.
A healthy eating bar was introduced for breakfast. This included fruits, yogurts and seeds. This promotion was done by the posters, which helped the staff to create the healthy eating campaign.
The nutritional standards and the food and beverage provisions in the healthcare setting really helped us when we were aligning it with the healthy eating programme. Every day we include healthy options in our menu. We try to keep them as seasonal as we can, so therefore they will be the freshest. We continue to add new and healthier items regularly. Training is also very important to us, as trends continue to change. Recently we received master classes based on plant-based options, which are healthier options for our canteen. The healthy eating programme has also helped us to get buy-in from staff in the catering department and the staff throughout the campus. The team also completed healthy eating training on the HSE land on the food and nutrition healthy eating set of modules.
Thanks very much, Anne and all the team in Cork, and congratulations on achieving the Gold Standard Award in the scheme. It looks absolutely fantastic down there. Just, I know somebody has asked in the Q&A there if it'll be possible to view the webinar again. The webinar is being recorded, and in the email that you'll receive at the end, the link to where you can access it will be there. So just moving on now to our next speaker, Claire Kearns. A number of years ago, we collaborated with the Health Research Board Sphere programme and supported Claire as part of her PhD scholarship to undertake a research project examining the barriers and enablers to implementing the calorie posting policy in health services. I know that some of you here today will have participated in that research with Claire. So I'd like to welcome Claire to share with us the results of the recently published project.
Good afternoon, everybody. My name is Claire Kearns, and I'm delighted to have this opportunity today to present some findings from our recently published study, which looks at implementation of the HSE's calorie posting policy in Irish public hospitals. And unfortunately, I'm unable to present live today as I'm on maternity leave with a newborn baby. So over the next 5 minutes, I'm going to give a snapshot of some of the findings from this study. But for those looking for more information, I've provided a link on this slide that you can access the paper for free. So in terms of some background information, we know that few studies report the extent to which calorie posting is implemented as designed, and most of these studies are in the restaurant setting. So we know there's been poor uptake of calorie posting in the restaurant setting, and there's issues in terms of lack of adherence to standardized recipes and portions, and in some instances inaccurate calorie information. And this has been published in a recent systematic review that our team conducted there last year. But to date, there's been no studies in the healthcare setting. And what is clear from the research is that evidence-based interventions or policies that are poorly implemented or indeed not implemented don't achieve the intended outcomes. So I suppose in terms of the HSE's calorie posting policy, the intended outcome there is to promote awareness of healthier food and drink choices amongst staff and visitors by highlighting the calorie content of food and drinks provided in HSE facilities. And since the introduction of this policy in 2015, progress reports have found inconsistent implementation. So some hospitals have not implemented calorie posting, other hospitals have implemented it on their breakfast menu only, and other hospitals across the full menu. And the current study aimed to assess the level of adherence to the HSE's calorie posting policy in Irish public hospitals, and in particular it wanted to assess adherence to the 4 policy conditions, which I'll mention in a moment, and it wanted to identify what were the influencing factors. In terms of methods, we firstly analysed the progress reports from each hospital to identify 4 hospitals with varying levels of implementation. These hospitals also varied in terms of geographic location, hospital type, voluntary and non-voluntary hospitals, and hospital size. And then we went into these 4 hospitals and we gathered multiple sources of data to get a better picture of the level of adherence to this policy and what were the factors influencing implementation in those hospitals. So the policy specifies that there are 4 conditions that must be adhered to in implementing calorie posting. Firstly, that calorie posting is in place for all food and drink items on sale, that it's displayed clearly at the point of choice for the consumer, that it's displayed per standard portion or per meal, and finally that there's information on how many calories an average person needs in a day, and that this is prominently displayed in order to help consumers better understand calorie information. So findings from this study showed that there was partial adherence to the policy across the 4 hospitals. So hospitals did not have calorie posting across their full menus. There was low adherence to providing calorie information per standard portion or per meal. And then finally, there was low adherence to standardised recipes and portions and inaccurate calorie information. And those final 2 points there were not covered in the policy conditions, but they were brought up in interviews by stakeholders, and they were also noted by the researcher during observations. So in terms of the findings on the barriers and facilitators, staff reported that there was a lack of access to information and training. So as a member of catering staff said, there was no supporting information to help us. We were all kind of working at it ourselves through the internet. It was up to yourself to get on with it. We really would have benefited from more information and guidance. So in the hospitals, staff seemed to be unaware of the HSE's calorie posting toolkit to assist them with implementation. We also found that catering staff were using the web in order to access information on calories, and that indeed may have led to inaccurate calorie information being posted in some instances. Another barrier was that staff initiatives took lower priority due to inadequate staffing levels and a culture which prioritised patient-centred care. So as a dietitian manager in one hospital said, patients are absolutely the priority because we don't have enough staff across the board. It's extremely stretched. We don't have resources to take on anything else. We don't even have the resources to manage the clinical service, never mind the health promotion type aspects, which are very, very important, but we just have to prioritise the patient work. Student engagement was both a barrier and a facilitator to implementation of the HSE's calorie posting policy. So in terms of it exerting a positive influence, staff reported that it helped overcome staff shortages and time restraints. So as one catering manager said, my student is doing it because I haven't got the time directly to give it. But in terms of having a negative influence, stakeholders reported that there was lack of appropriate student supervision and varying levels of nutrition knowledge amongst these students. So a dietitian manager said, I noticed on the posters, like some calories straight off as a dietitian, I could tell that's not right, that's wrong. Because there was no direct supervision from a dietitian, I think there are probably a lot of errors in the calculations. External policies such as national HSE policy, monitoring and incentives such as external accreditation from, for example, the Irish Heart Foundation, this exerted both a positive influence and a negative influence. So in terms of a positive influence, the external policies, monitoring and incentives helped engage hospital and catering management in particular, and it generated this urgency to implement calorie posting. So as a dietitian manager said, it's our national policy, the calorie posting in terms of the HSE. Regardless of whether or not consumers want it, it's policy, so it should be implemented. A catering manager also said, external accreditation holds a lot of weight. It makes it easier to negotiate and to kind of keep a door open, particularly at the executive level with the HSE, with the hospital CEO. So although it exerted this positive influence, the negative influence of this was that there was a risk of tokenism, which was leading to superficial implementation. And an executive head chef said, I think they take on these projects and they look and sound good. They're ticking boxes and that you know. But it's a tick the box, it looks done, but is it really done? No one really checks. I don't think we've fully implemented calorie posting yet. So I suppose in terms of recommendations from that we can draw from these findings, I suppose firstly, we need to start with policy development. So in the study we found that, adherence to standardised recipes and standardised portions and the accuracy of the calorie information weren't part of the policy conditions. So really it highlights the need for adequate documentation of intervention components and the activities involved in order to implement the policy. Another recommendation would be to ensure that there's availability of supporting materials and training opportunities, but really important that stakeholders are aware of and able to access this. So for example, are PCs required, and if they are required, can catering staff access these PCs? Another recommendation will be to consider human resources and its impact on time and capacity to implement such initiatives. Our staff, our catering staff, able to be released for training. That's an important consideration. So we can have these training courses, but our staff, are we able to release staff to attend this training? Then student engagement, I suppose we need to consider intervention, responsibility and accountability. Who does that fall on? And if we are going to engage students in implementation of such policies, we need to consider training and supervision of these students, and that really needs to be a priority. And finally, monitoring and feedback is required to maximise stakeholder engagement and to contribute to successful implementation. So to prevent standards slipping over time, monitoring and feedback is really important. And again, that research shows that is really critical when it comes to preventing slippage over time. So finally, just to acknowledge all the people that were involved in this research and our funders, the HRB and the HSE, my primary supervisor, Dr. Colette Kelly from NUA Galway, and we had an advisory group that was established by the HSE's Healthy Eating and Active Living Policy Priority Programme, and they provided much input into the design of the study. We also would like to thank the hospitals and the stakeholders participated in the study, and the research collaborators and co-authors. And today really only gives a snapshot of some of the findings. If you read the paper, you'll see that there was a lot more findings and a lot more complexity attached to the factors that were influencing implementation. But if you would like to contact me with any particular queries, my email address is there. I'm also available via Twitter. I've provided a link to the paper, but also a link to some additional papers that might be of interest, and one of them also includes the recently published systematic review on the factors influencing implementation in the restaurant setting. Thank you.
Thanks very much, Claire. That was really, really interesting, and it was a fantastic piece of work to be involved in, and really great to hear those recommendations, but also very clear and well articulated experience in terms of like what happens on the ground for services in implementing policies. We will be the HSE calorie posting policy is due for review, so we will be very much drawing on the work of Claire and that feedback when we're reviewing and updating the policy. So I suppose I'd like to now invite a number of our contributors this afternoon, Geraldine Sexton, Anne Bodley and Orna O'Brien, to join me for a panel discussion with Joanna Da Silva, Chief Specialist in Nutrition with Safe Food. Hi, everybody. And maybe just as people are coming on, I wonder, Dennis, could we maybe just throw up the results of the poll as well there? So yeah, look, thank you. It's great to see that there would have been an awareness of the nutrition standards before people joined us today, which is fantastic. Hopefully that will increase across the system as you share the information and links to the webinar with colleagues and your teams locally. And in terms of the nutrition modules on HSE land, we would hope to see over the coming weeks and months that some of you will be able to link into those and use them. So it's great that people have a greater awareness of them now today, out of today, than maybe before. So Joanna, can I come to you to start, and thank you very much for joining us. Geraldine would have touched on it in her presentation, but we were very pleased during the development of the standards to have your input, and because Safe Food is an all-island body, you work both north and south, so we're able to bring some key insights from your work with partners in Northern Ireland into the development of the standards here in the Republic. So could you maybe tell us a little bit about that, please?
Thank you, Sarah, and good afternoon, everyone. So we have been working in this area in Northern Ireland since 2016. The obesity policy tasked 3 organisations at the time with the development of standards for staff and visitors in health and social care settings. So Safe Food started this journey in 2016 in partnership with the Food Standards Agency and the Public Health Agency. We reviewed what was being done internationally and in other areas of the UK, both in terms of policy and practice initiatives. Some of the examples included the Public Health England Toolkit for a healthier and more sustainable catering, the experience of implementing a Healthy Living Award and healthcare retail standards in Scotland, for example. So the standards were developed, the Northern Ireland ones were developed by a small technical group made up of nutritionists and dietitians, and then this was progressed by a steering group. We have colleagues that represent procurement, we have colleagues that represent catering, and they were finalized back in 2017, and we have been working on the implementation of those standards up to now. That steering group is still very much active and alive. In Ireland, Sarah, the HSE through the Healthy Eating and Active Living program led on this work, and Safe Foods supported the program by collaborating with the technical group that developed the very initial set of the standards. A lot of the work we did was to adapt and to localize what we had done in Northern Ireland to the Ireland reality. So we used the food pyramid, the healthy food for life resources, and you yourself alluded to that during your presentation. It's about bringing that food pyramid to life in different contexts, being standards for schools, being the menu plans that we develop for consumers, or the standards for health and social care settings. We also had to be very careful in terms of the guidance for caterers to make sure that it was current, that it was relevant in terms of procurement, displaying and producing the food in an Irish context. So once that subgroup was happy with the draft standards, the next step was to bring that to the Healthier Food Environment Advisory Group. So this is an HSE group that brought together colleagues with different experiences and expertise, from catering to nutrition to dietetics, well-being, procurement. Some of them are here today. And this group provided immense support, great feedback. They asked very hard questions. When are you going to do this? How? Who is going to do this? And they provided solutions too, so we could incorporate that into the document, into the guidance. And that's what made the standards the implementable standards that you see here today. On behalf of Safe Food, I can only say that I am delighted to see the standards being launched today. And I like how you have a very clear plan in terms of recognition for what is going to be done, what's going to be implemented, but also for everything that is already in place across the healthcare facilities in Ireland. To see the Irish Heart Happy Heart Healthy Eating Award linked to the standards, this is a major step in terms of rolling them out. I feel that the All Ireland collaboration worked really well. And while we are talking about the standards today, I think it's important to mention that the work that the HSE has done in terms of healthier vending policies is already influencing what we are doing now in Northern Ireland with vending. So I think that interaction is very positive.
Yeah, no, it's great, and it was fantastic, and it's great to be able to share across both ourselves and colleagues in Northern Ireland the learnings. And it does sound very much from what you described, Joanna, that a big focus in the process of developing the nutrition standards was that practicality, a focus on implementation. How real can this be, and a recognition of the challenges that people in practice might face. And I suppose on that note, maybe can I just come to Orna and Anne and put the same question to you, maybe from your different perspectives, in terms of, like, from maybe Anne, from your experience in Cork, what do you feel are the key success factors for the Healthy Eating Award?
Well, I suppose from the CUH point of view, we kind of started off with a survey for the staff of the hospital. So if you have the buy-in from the staff, and from that survey, we found that a lot of people were really looking for more healthier options. So it made it a little bit easier when you know that the momentum is there anyway. The other thing was getting the buy-in of the catering staff themselves. And, we've talked about training, but from a chef point of view, practical training is always as important as the HSE land training, which is really, really important too. So it's just keeping people fresh in their ideas in terms of, menus, etc. So I think that the award scheme keeps us on our toes too. So, I don't think it's a case of sit down, we've done it all, well done, and move on. I think it's always going to be progression. As younger people come into the HSE to work, they have different ideas of what they would eat for their dinner as I would. So it's important that we keep on top of it. And I do think having the awards annually, it gives people a momentum to keep them focused as well. And I think it's really important that for people looking at it and deciding whether it's for them or not, Rome wasn't built in a day. I think it's small steps to start with. The training programs online are very, very, very helpful. And from there, I know that some of my colleagues would have had issues with procurement. Some items mightn't necessarily be on procurement lists, but the procurement department, Brian and the team will always help you in if there is an item that you want to get, once you obviously get local authorization. But, so it's a buy-in from different areas of the hospital too. The dietetics department, obviously their focus would be patients. But, I think, if you have a good relationship with the dietetics department, they will buy in to what you want to do as well. So, from my side, from the CUH's side anyway, I think it's been a great success just to get everybody involved. But as I said, we have to, I think Orna's made it a little bit more difficult for us this year. So we have more little bits and pieces to get sorted before we go for it now. But don't give up. It's always a progress is made, small steps.
Great, and thanks very much, Anne. It's about starting the journey, isn't it, really, and keeping going out. Orna, from your perspective in terms of working with services, what would you see as the key success factors?
Absolutely, and Anne, I don't think you could ever be accused of, resting on your laurels. I think you're always pushing it and seeing how we can continue to improve it. So, I'd echo a lot of what Anne has mentioned already, that you absolutely have to have the senior management buy-in from the get-go. You need the support and the engagement to drive it forward, and staff engagement as well is so important. So that can be as simple as reinforcing healthy eating messages at regular intervals throughout the year, tying in, keeping healthy eating on the agenda by tying in different, let's say around Valentine's Day and doing a heart themed health promotion, or around this September, which is Heart Month, another great time to keep healthy eating on the agenda, and using lots of different motivational strategies like that to get the customers on your side. I think, again, as Anne mentioned, gradual positive change, and I know there has been some more changes this year than other changes as we slot into the structure of the HSE nutrition standards. But that's where the bronze, silver and gold helps, because no site, it's very rare that a site would be able to start and go straight to gold. This is a health promotion initiative. We aim to bring people along with us on the journey and build that sustainable change over time. And as I said, Rome isn't built in a day. It does take time. And lastly, I'd just say that communication all the way. You cannot get your healthy eating award without being really collaborative in everything you do, linking in with different departments, different stakeholders, both locally with the Irish Heart Foundation, asking for help, reaching out for support, because there's so much there.
Yeah, Okay, fantastic. Thanks a million, Orna. And I see just in the Q&A there, Helen is asking if anybody would like to share their staff survey. I don't think we can do it necessarily through here, but I'm sure kind of through linking with yourselves, Orna, that people will be able to access supports and probably tools and aspects that others have done, and maybe even kind of there's something to maybe think about in terms of creating a kind of a network across the health services of catering staff who are engaged in this to I suppose build on that sharing, learning, and generation of great ideas.
Sarah, can I just add on to that point there that we're currently updating our website on irishheart.ie on the Healthy Eating Awards. So in a month or so, we will have all of our support resources up there available. But if anyone does want to contact us directly for anything like the staff survey, please do so. It's o'brien@irishheart.ie.
Great, thanks a million, Orna. And I know just there in one of the queries earlier on, Geraldine, you touched on it in your presentation in terms of nutrition standards, the whole area of plant-based foods, and I know we were lucky to have three dietitians on the call today, but I just wonder if you could maybe pick up on that in terms of like how does the whole plant-based movement fit with the healthy eating guidelines?
Well, plant-based eating has really grown in popularity over the years, with people being drawn to it for climate, health and animal rights reasons. And foods derived from plants are often nutrient dense, meaning they're high in vitamins, minerals, fibres and low in calories. But the thing is that following a plant-based diet and choosing a vegan lifestyle are two very different things. And I think a lot of people aren't actually aware of that. So enjoying a plant-based diet, it doesn't stop you from actually consuming animal products, but rather places more of a plant-based foods or puts them more in a prominent role. And as someone who's really passionate around gut health, I'm really in favour of that. Now, there is a lot of strong, high quality evidence that shows that following a plant-based diet can have numerous benefits, including reducing or improving chronic disease risk, being budget friendly and having a positive environmental impact as well by reducing the need for unsustainable agricultural practices. Now, if you want to go fully plant-based, then it's important that you do follow a varied, balanced diet, meaning that you're making sure that you are looking at the food pyramid and that you're making sure that you're getting plenty of different varieties of fruits and veg and plant-based proteins. And just to be aware as well that certain vitamins and minerals may be difficult to obtain without animal-based foods. But if you work with a dietitian, you can get creative and very strategic with the food choices. So things like adequate calcium and vitamin D may seem difficult without including your dairy products. But if you are taking plant-based sources like your tofu, your dark green vegetables, your plant milks, and even fortified cereals or orange juices, that can help. Vitamin B12 is another one that can be quite common for people who are avoiding meat or animal products. So supplementation can be required, but there are an awful lot of non-animal sources too, such as nutritional yeast, fortified cereals, and certain plant milks as well. So you can definitely follow a plant-based diet, be it either 100% plant-based or partly plant-based. But remember just to keep looking at the food pyramid, because it is a way to, I suppose, for the general population, it is a way to make sure that the plates are as balanced as they can be. So hope that answers the question.
Yeah, great. Thanks. Very comprehensive, Geraldine. Joanna, Orna, I don't know if you want to add anything to that.
Yeah, and I might just even go back to basics and say that even looking at the Irish food pyramid, only 1 in 4 of us meet at least 5 a day for our fruit and vegetables, and 80% of us are not meeting our fibre requirement of 25 to 29 grams of fibre per day. So we know already, this is obviously a question about fully plant-based movement, but even meeting the what's laid out in our national food pyramid would be a huge achievement on a population level. So even if we can move a little bit closer that way, it will be such an incredible benefit. And even 1 extra portion of fruit and vegetables every day reduces your risk of heart disease by 30%. So it's so powerful. We cannot, even moving towards a more plant-centric approach would endorse what we already have in the food pyramid.
Okay, great. Thanks very much, Orna. And Joanna, I think if I'm not mistaken, the Department of Health and yourselves are working on developing some a fact sheet around plant-based nutrition
practical
to
resources to some practical resources to bring to life what's already there. Even on the protein shelf, the food pyramid already highlights good sources of good vegetable sources of protein, and it's about reinforcing that message. They are versatile, they are affordable, very affordable, low in fat, rich in protein and many micronutrients. So we will be doing some work over the coming months on that to communicate that message in a more accessible way.
Great. Thanks very much. Guys, we're coming to a close in terms of our time. Just looking at the Q&A there from the audience, I think there's one particular query in from Joan, who works in a intellectual disability residential sector. I think, Joan, we're probably not able to answer that query here. It relates to food portioning and dinners and suppers delivered in period consistency. But maybe if you're interested in engaging and connecting in around the Healthy Eating Awards as part of that process, there might be some greater clarity there. Orna, I doubt that you'll be able to provide any specific guidance without knowing the content or the.
No, I mean, if Joan, if you'd like to give us a call or drop us an email, we can certainly take this offline and discuss it and see if there's any way we can support you.
Yeah, that's great. Thanks very much. Thanks a million, Anne, Orna, Geraldine and Joanna for your time, and thanks also to Claire who wasn't able to join us on the panel. I hope for all of you in the audience, I hope you really enjoyed the session this afternoon, and that the information and discussions have stimulated your energy and interest to continue the journey to creating a healthier food environment across our health services. I'd also like to thank in particular, and the list is probably too long to work through all those over the last number of years who've participated in the various working groups, and also worked as project managers and project dietitians across the development of the various policy documents and tools and resources that we've highlighted today. Your work has been invaluable, and it's fantastic to be showcasing it. And I'd like to mention in particular in terms of today and all their work in the background, Emer Cotter and Eamon Keogh, thank you very much for getting us here and for holding your nerve through the cyber attack, and Helena and the team in IMS for hosting us. So thank you very much, everybody. You will be getting an email from us with the link to the recording of the webinar and also the various documents. Please do feel free to share that with your colleagues and team members who may not have been able to attend today or not have registered. And look, we look forward to continuing to work with you and hopefully seeing many of you come through the Healthy Eating at Work Awards process and the celebration and recognition of your work at that level. Thanks very much, everybody.